our final speaker for this session is Ngareta Melgren. Is that Ngareta Melgren, who is talking to us about creating healthy, active, nourished generations. And Ngareta is the Community Health Manager at Rural Northwest Health. Welcome.
Thank you, Penny, for that warm welcome. So I'm here today to talk to you about the YChange project, which is a project that we've been working in partnership with Deakin University, the Yarriambiack Shire, as well as Dunmunkle Health, although Dunmunkle Health is now West Wimmera Health Services. So what is the YChange project? The YChange project is a community-led and driven obesity prevention project. And we've got this very clever little acronym up there. YChange stands for Yarriambiack, Creating Healthy, Active, Nourished Generation. We thought it was clever. So just a little bit about Rural Northwest Health, who we are. So we're a small rural health service based in the central and northern part of the Yarriambiack Shire, and we have 3 campuses in Warratonville, Beulah and Hopetoun. So if you don't know where the Yarriambiack Shire is, we're the blue bit up the top there, Melbourne's down the bottom, and it takes approximately 4 hours to get to Warratonville from Melbourne. So it gives you a bit of a perspective of how rural we are. I also wanted to share some of the Yarriambiack Shire Victorian population health statistics that were quite alarming for us. In the Yarriambiack Shire, over 65% of our adults are either overweight or obese, and we also have the highest sugar-sweetened beverage consumption per capita in Victoria. So those 2 factors kind of marry up a little bit. So what is obesity? So anybody who was here yesterday in Steve's workshop, or if you've had the privilege of being in any of the Deakin workshops looking at the systems approach, you'll be very familiar with the next 3 slides, so please bear with me. So if we look at obesity and what causes obesity, a basic model is that energy in, energy out. If we consume too much energy that we don't expend, we're going to have an excess in energy, which is going to convert to fat. Pretty simple. So a simple view is that a healthy weight is achieved by balancing food consumption and the energy we expend. Pretty simple, that's what we're all taught. However, the actual complexity of the problem of obesity is far more complex than this. This is the Foresight model of obesity. This actually shows at least 108 causal determinants or causal factors that can contribute to weight status. This shows the actual complexity that we are dealing with when we are talking about the obesity problem. It is not simple as energy out, energy in, which is why a single level approach, a single program, does not work in addressing obesity. Considering the Foresight model and thinking about sustainable obesity prevention, we really need to acknowledge this complexity. We need to understand the causal factors that contribute to the complexity of obesity, but we also need to understand that those causal factors change over time, which again makes it even more complex of an issue. We need multi-component strategies to address the issue, and solutions require strong collaborations. So can Yarriambiack lead and sustain obesity prevention? Well, we certainly hope so. And this is the pie-in-the-sky dream, that we will obliterate obesity and overweight completely. This is the ultimate outcome that we want to see come with YChange. So the project aims. The first thing that we wanted to do, and we are doing, is to build the knowledge and the skills of both the health and the non-health key stakeholders in the Yarriambiack Shire. We want to use a systems thinking approach, look at the bigger picture and bring the community along with us. Using the collective impact model, and also evaluate everything we can. Although we're looking at obesity, we don't want to focus just on evaluating BMIs. So essentially what the YChange project is aiming to do is to be a short-term catalyst for long-term community-owned and designed changes to make the default choice the healthy choice, which we believe is going to cause sustainability. Make the healthy choice the easy choice. So what have we done so far to date? Thank you, Clinton. Clinton's given an overall map of what happens in the process of this process that we do with community members. So we've engaged key stakeholders, leaders and community members across the whole of the Shire. Now, the thing that is different with the YChange project is we've actually engaged in 3 main communities across the Yarriambiack Shire. So that's Warracknabeal, Hopetoun and Dunmunkle. We gathered these 3 communities together and we asked them, can you identify the variables that you think are contributing to this issue of obesity within your communities? So again, it was very specific to their communities. They were then asked to map their fears and their hopes for each variable using the behaviour over times map. So this variable is looking at consumption of soft drinks because we've got the highest rate in Victoria. So basically coming from the past into the present, you can see there that the pattern is that the consumption is going up. The fear is that the consumption will continue to go up, but what we are hoping is that the consumption will go down, and that is one of the gamuts of the YChange project. So we took all of these variables that the community members identified, and we turned them into this thing that's called a connection circle. So all of the variables that each community identified were put around connection circle, and then they were asked to identify how each variable was interrelated and connected to each other. And again, Clinton's already spoken to that. And so for one example here is the lack of food skills and knowledge can lead to an increased consumption of fast food. Once we'd completed that with the community members, this is what the connection circle ended up looking like. You'll agree, very busy, very messy, very hard to understand. So what our friends at Deakin University did is they took these connection circles away and they formulated causal loops for us. They did their magic, their academic magic, and what they came back with was these. So again, this is the Foresight model up here in the right-hand corner. This is one of the causal loop diagrams. So this is the Hopetoun causal loop diagram, and we also have one for Warracknabeal and Dunmunkle. We then re-engaged with all the communities and asked them about what strategies and what action points they felt could actually impact around these key points within the causal loop. Here is an example of Warracknabeal's action ideas. So these were action ideas that came from the community and very much driven by the community. You can see there that we've had a look at the Creekside menu, the hotel menu, school and kindergarten policy, hospital cafe menu and workplace food policies were very key to the Warracknabeal community. Overall, the YChange project, considering that there are 3 communities involved, we've identified and prioritised these 7 strategies. And I think the key is that the 7 strategies go across kinders, schools, workplaces, food outlets and sports clubs. One of the really important things that has come out of the YChange projects is having clear communication strategies. These strategies that the YChange has adopted have been drawn from the leverage points within the causal loop maps to maximise systems level change as much as we can. So what are the real learnings so far for us with the YChange project? So I guess the key thing that I would like to say here is that people are either the greatest enablers and they can be the greatest barriers also. So in terms of the enablers, we've got Rural North West Health, and I guess we're a key enabler because we were the key body that actually went to Deakin and said we've got an issue here. So we're very much on board, it's very important to us. Our strong community members and effective collaborations with our communities and Deakin and our partners. So that's where we come to the next level of trust. It's actually trusting. A true collaboration is recognition of trust of everybody's skill and knowledge and experience who are contributing to the YChange project. The fact that we had 3 separate communities was interesting because we are a rural and remote area. The 3 communities identified very different causal factors and things that they felt they needed to action to improve that. So that's been a strength and enabler. The barriers again does come down to people. Some partners are less engaged, and there have been some leadership issues in some of the organisations. There's an entrenched unhealthy environments in some of the areas across the Shire, workplaces, schools, and they are actually really hard to improve once they are entrenched within communities. There's also this small local business earning a living out of some of the business that we can view are not necessarily helping with the obesity epidemic. So fast food takeaway shops, bakeries, all of those sorts of things. So we had to be really mindful that we can't blame and shame these small communities, because this is how they make a living. They are part of our community. There is, and Clinton talked to this, there is a little bit of a level of distrust about who are these people coming into our community and telling us what to do. The vast geography, the expanse of the Yarriambiack Shire has been a difficult one for Deakin to manage to get to the top and to the bottom, and so resources are thin. And again, human resource capacity, I think, in the Yarriambiack Shire we have a population of 7,000 people, so we don't have the capacity and the resources of bigger communities. Lastly, I'd like to leave you with this. We don't have any of these usual suspects that will come into the front of our mind when we talk about obesity and overweight. So we assume that would make our problem easier to deal with in the Yarriambiack Shire. I'd actually beg to differ, it's actually made it a lot more difficult. So lastly, I'd just like to finish and acknowledge our partners, our community members and our funders for making YChange a real project. Thank you.